Okay, so if you're like most people listening, artificial intelligence, AI, it's probably already woven into almost every part of your
Oh,
life.
absolutely. From streaming suggestions to maybe smart home stuff.
Exactly. And let's be honest, maybe helping draft that quick email or finding an answer for, a tricky question for work or school.
hmm These tools offer just incredible convenience, and they sort of promise effortless learning.
And that promise, particularly in education, that's exactly what we're diving into today.
Right. Our mission here is to really unpack this essential new study. It rigorously tested how well three popular generative AI tools, we're talking ChatGPT, Copilot, and Google Gemini, perform in a very specialized, very critical field.
Healthcare education, specifically cardiovascular pharmacology.
Yep. So we want to figure out, which AI tools are actually accurate, which are reliable for medical learning.
And just as crucial, what are their limitations? Because they definitely still have them.
hmm And for you listening, this isn't just about, say, getting better grades.
No, it's really about the future of well-informed healthcare professionals. High stakes.
Definitely. So first off, why pick cardiovascular pharmacology?
Good question.
Well, it's a foundational subject, but it's also really complex in healthcare training. You absolutely have to master it to understand how drugs work, how to manage heart conditions.
So it requires both the facts, but also applying those facts.
Exactly. Applying the knowledge in like real-world ways, it makes it a perfect kind of challenging test for these AI systems.
Okay, so who were the contenders in this test? You mentioned three big names.
That's right. They looked at ChatGPT-4, that's from OpenAI, then Microsoft Copilot, which uses tech from GitHub and Microsoft,
Mm.
and Google Gemini from Google DeepMind.
And importantly, these were the free versions, right?
Yes, the free versions, which is key because that's how most students, most educators would likely access them.
Makes sense. And the study accessed them back in September 2024.
Correct. Now, the testing ground itself, it was pretty thorough.
Oh, so
They used two main kinds of tests: multiple choice questions, MCQs, and short answer questions, or SAQs.
okay, standard testing formats.
Yes, but they added layers of difficulty: easy, intermediate, and advanced for both types of questions.
Ah, so they really wanted to see where the AI is tripped up.
Precisely. They weren't messing around. We're talking 45 multiple choice questions in total.
15 for each difficulty level.
Yep, 15 per level, each with 5 answer choices, and then 30 short answer questions, so 10 for each difficulty level.
Wow, that's quite a few. How did they ensure the questions were actually, good quality, not just random facts?
Great point. The rigor here really stands out. All the questions were original. They were crafted specifically for this study by an experienced pharmacology professor.
Okay, that's good.
And then, to double check, two other pharmacology professors validated them. These weren't just any professors. They had extensive university teaching experience, specializations in cardiovascular pharmacology.
So the questions were guaranteed to be challenging and relevant.
Exactly. Truly testing the AI's capabilities in this specific field.
And they were careful about how they prompted the AI, too, I gather.
Very careful. Only one prompt per test for each AI tool. This was to maintain the integrity of the results, minimize any systemic errors from, slightly different phrasing.
Smart. Okay, so the AI generates the answers. How did they judge them, especially the short answers?
Right. MCQs were simple, correct, or incorrect.
Black and white.
Yep. But the SAQs needed more nuance. Those same three pharmacology professors independently rated each short answer response.
On what basis?
They used a 1 to 5 scale, looking at accuracy, relevance to the question, and the completeness of the answer.
And did the professors agree on the ratings?
That's the crucial part for trusting these results. They had incredibly high inter-rater reliability. The statistic, Flace's kappa, was 0.873.
Which means?
It means almost perfect agreement among the evaluators.
Mhm.
So we can be really confident in how they scored those answers.
Okay, makes sense. Let's get into the results then. Starting with the multiple choice questions. What did they find?
Well, initially, it looked like a real success story for AI.
How so?
For the easy and intermediate level MCQs, all three models, ChatGPT, Copilot, Gemini, showed really impressive accuracy. We're talking ranges from 87% up to 100%.
Wow! 100%.
Yeah, ChatGPT actually got a perfect 100% on the easy multiple choice questions.
So for basic facts, foundational knowledge, AI seems pretty reliable.
Highly reliable. It suggests they're great tools for reinforcing those basic principles, kind of like a superpowered flashcards or a very patient tutor for the fundamentals.
Okay, but that was easy and intermediate, you said initially. What happened with the advanced MCQs? This is where it gets interesting, right?
This is exactly where it gets interesting. There was a significant drop-off in performance as the questions got more complex, more advanced.
How significant?
Well, ChatGPT managed to maintain the highest accuracy, but even that dropped to 73%.
Still, 73% isn't terrible for advanced questions.
It's the best of the three, but look at the others. Copilot dropped way down to 53%.
Oof. Okay.
In Google Gemini, it plummeted really low, down to just 20% accuracy on the advanced MCQs.
20%. That's barely better than random guessing on a 5-choice question.
Pretty much. And here's a key statistical point. For Copilot and Gemini, the drop in performance from the easy intermediate questions to the advanced ones was statistically significant.
Meaning it wasn't just a fluke, it was a real measurable decline.
Exactly. ChatGPT's drop was numerical, yes, but it didn't cross that threshold of statistical significance in the same way.
So what's the big takeaway from these MCQ results for you listening?
It tells us something really important. While AI is great at simpler tasks, recalling facts, its ability to handle complex scenarios, the kind that need critical thinking, deeper understanding, applying principles like you would in a clinical setting.
That ability really diminishes.
Significantly. And that raises a major concern, doesn't it? If you rely only on AI for advanced topics, especially in healthcare.
You could end up with serious gaps in your understanding, and in medicine, those gaps can have real consequences.
Absolutely. It's one thing to know what a drug is, quite another to know how and when to use it safely and effectively in a complicated patient situation.
A very sobering point. Okay, so that's the MCQs. But you mentioned the short answer questions. The SAQs told a different story.
Yes, a very different and quite fascinating story. Here, both ChatGPT and Copilot performed really well.
Even on the advanced questions.
Yes. They both showed consistently high accuracy scores across all difficulty levels for the short answers, easy, intermediate, and advanced.
So no big drop-off like with the SAQs?
Nope. The study found no significant differences in their performance across the SAQ difficulty levels. And interestingly, there was no significant difference between ChatGPT and Copilot either on these SAQs.
That's surprising given Copilot's drop on the advanced MCQs.
It is. It suggests they both have a really robust ability to generate detailed, accurate, explanatory answers in this field, even when the questions get complex.
Okay, so ChatGPT and Copilot did well on SAQs. What about Gemini? Did it bounce back?
Unfortunately, no. Gemini showed a consistent pattern, but it was a pattern of lagging behind.
Across the board on SAQs?
Yes, it performed significantly lower than both ChatGPT and Copilot across all SAQ difficulty levels. Its scores on the advanced SAQs were particularly low.
And was its drop-off from easy intermediate to advanced SAQs significant like it was for the MCQs?
Yes, it was. Gemini's SAQ performance also got significantly worse as the questions became more advanced, unlike ChatGPT and Copilot in this format.
So we have this really mixed picture. MCQs show a steep decline for complexity, especially for Gemini and Copilot. SAQs show ChatGPT and Copilot holding strong, but Gemini's still struggling. What explains these differences? Is it the AI models themselves?
That's the million-dollar question, isn't it? It likely boils down to a few things.
Like what?
Well, the underlying architectures and training methods probably play a big role. ChatGPT, especially GPT-4, uses something called reinforcement learning from human feedback, RLHF. That fine-tuning process might make it just better suited for tackling these complex medical scenarios, generating more coherent, context-aware answers.
In Copilot, it uses a GPT model too, doesn't it?
It does, but its design focus has traditionally been more towards code generation and completion, even though it's broadened its scope. ChatGPT is really optimized for that broad, human-like text generation.
Okay, that makes sense. And Gemini? Maybe it's just newer or focused elsewhere.
That could be part of it. Being newer, perhaps his strengths lie in other areas, or its training specific to this kind of complex medical education query isn't as developed yet. It might be more specialized differently.
It's also worth remembering how fast this field moves. You mentioned ChatGPT-4.
Exactly. Previous studies using older versions, like ChatGPT 3.5, often showed lower accuracy. The improvement to version 4 is clear, and it aligns with its strong performance here.
And other recent research often finds ChatGPT-4 and Copilot are quite comparable on open-ended medical questions.
Yes, that aligns well with these SAQ findings, where they performed similarly well.
Okay, so connecting this all back to the bigger picture, what's the main message from this study?
The study clearly shows that while these AI tools have immense potential to help with learning, their effectiveness really varies. a lot.
Depending on the tool you use and how complex your question is.
Absolutely. ChatGPT and Copilot seem like pretty strong supplementary tools in a field like cardiovascular pharmacology. Good for basic facts, good for getting detailed explanations.
But Gemini, at least based on this study in this specific area, shows some significant limitations.
Correct. Which leads to the study's really crucial call for caution.
Don't throw out your textbooks yet.
Definitely not.
Yeah.
AI should be seen as a supplement, something to aid traditional learning, not replace it.
Especially for the advanced stuff.
Especially then. When you get to advanced or clinical level material, incorrect or incomplete information isn't just, inconvenient. You could have serious consequences for patient safety down the line.
Right. Clinical decision-making relies on accurate, nuanced understanding.
So any information you get from AI, especially in medicine, must be critically evaluated. You can't just copy-paste.
Which raises that important question for you, the learner, again. How do you actually use these powerful tools effectively, but also responsibly?
Yeah, how do you leverage the good parts while staying very aware of the potential pitfalls? It's not about banning AI.
No, it's about teaching discernment.
Exactly.
Yeah.
Educators really have a role here, guiding students on responsible AI use, integrating it thoughtfully into how we teach, rather than just letting students rely on it uncritically. It comes back to teaching critical thinking above all else.
So if we had to boil it down, the core message is these generative AI tools are powerful, no doubt. But their accuracy, especially in specialized high-stakes fields like medical education, it's variable.
Highly variable. Depends on the tool, depends on the complexity. Your own critical thinking, your own judgment remains absolutely essential, paramount.
And that leaves us with a really important thought to ponder, doesn't it?
Mm-hmm. As AI keeps evolving, and it's evolving at this just staggering pace, how do roles need to shift?
Both for educators and for learners like you. How do we adapt to make sure we maintain the absolute highest quality of knowledge and decision-making?
So especially in fields like healthcare, where the stakes are so incredibly high. Maybe think about it this way. What concrete steps could you take right now to critically evaluate the information you get from AI in your own learning journey?